Before starting this medication, make sure to read the medication guide provided by your pharmacist. This medication is given by injection into a vein by a healthcare professional over at least 30 minutes, as directed by your doctor, usually once every 4 weeks. Be aware that infusion reactions may occur while receiving the drug. If you experience symptoms such as fever, chills, flushing, dizziness, or fainting, be sure to inform your doctor right away. The dosage is based on your medical condition, weight, and response to treatment. Your doctor may stop your treatment for some time if you experience serious side effects, and may also prescribe another medication, a corticosteroid such as prednisone, to help treat side effects of this medication. Some common side effects of Opdualag 240 mg, 80 mg/20 ml intravenous solution may include nausea, diarrhea, loss of appetite, headache, bone/muscle pain, or tiredness. Serious side effects may also occur, but your doctor has prescribed this medication because the benefits outweigh the risks. Your doctor will carefully monitor you to decrease the risk of serious side effects. Contact your doctor immediately if you experience signs of infection, mouth/throat sores, severe stomach/abdominal pain, symptoms of liver or kidney problems, easy bruising/bleeding, swelling, weakness, irregular heartbeat, muscle weakness/pain, numbness/tingling, loss of coordination, eye redness/pain, sensitivity to light, or vision changes. This medication may also cause hormone gland problems, so be sure to report any symptoms such as cold or heat intolerance, unexplained weight changes, increased thirst/urination, or mood/behavior changes. Seek medical help right away if you experience chest pain, shortness of breath, severe itching, or a rash that could be a sign of a severe reaction. Although rare, a serious allergic reaction may occur, so seek medical help if you notice symptoms such as swollen lymph nodes, rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. Before starting Opdualag 240 mg, 80 mg/20 ml intravenous solution, it's important to discuss any allergies you may have with your doctor or pharmacist. This medication may contain inactive ingredients that could cause allergic reactions. You should also share your medical history, especially if you have immune system problems, have had an organ or stem cell transplant, or are planning to have surgery. If you are pregnant or planning to become pregnant, it's important to talk to your doctor about the potential risks and benefits of using this medication. It's also important to discuss with your doctor if you are breastfeeding, as it is unknown if this drug passes into breast milk. Your doctor can provide guidance on the best approach for your specific situation. When taking Opdualag 240 mg, 80 mg/20 ml intravenous solution Antineoplastic, anti-program death-PD-1/L1, MAC antibody, it's important to be aware of any potential drug interactions. These interactions can affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This will ensure that you are taking Opdualag safely and effectively. If someone takes too much Opdualag and has serious symptoms like fainting or difficulty breathing, call for emergency help immediately. In the U.S., you can reach the Poison Control Center at 1-800-222-1222, and in Canada, contact your provincial poison control center. Before starting treatment with Opdualag, it is important to undergo certain medical tests to check liver, kidney, and thyroid function, as well as blood sugar levels. These tests should also be conducted regularly during the course of treatment. It is essential to attend all medical and laboratory appointments as scheduled. It is advisable to consult with your doctor for more information on these tests. Make sure you take each dose of Opdualag 240 mg, 80 mg/20 ml intravenous solution Antineoplastic, anti-program death-PD-1/L1, MAC antibody on time. If you happen to miss a dose, be sure to consult your doctor or pharmacist immediately to arrange a new dosing schedule. This medication is typically given by a healthcare professional in a hospital or clinic setting and is not intended to be stored at home. It is important to follow the instructions of your healthcare provider regarding the administration of this medication. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.